Okay, so my name is Sarah Saluski. I work for Wood County Health Department, just across the bridge on the 3rd floor, and I am a health promotion communications specialist with the department. I've been there for about 3 years now, and I'm here just to chat with you a little bit more about our River Rider Bike Share program, how it kind of came to fruition, what it's all about, and why we think it's important. So. If you have any questions during, feel free to ask me, or there'll be time at the end, I'm sure, that we can kind of roll through some questions too. I think you'll see that there's quite a bit to it. So one of my roles at the health department is I lead Recreate Health under Healthy People Wood County. Healthy People Wood County is formed out of an IRS mandate to local hospitals and health departments to do community health assessments, and then create improvement plans from those health assessments to address community health needs throughout all of Wood County. So there's a steering committee that works to put this community health assessment and improvement plan together that consists of Legacy Foundation, the health department, and then all the local hospitals within Wood County, as well as additional providers that will be joining our team this year. There's 4 coalitions that address the health priorities. Mine is Recreate Health here. Look at it. Nice and animated. And my coalition really looks at nutrition and physical activity from a policies and systems and environmental level of change. So instead of telling people to work out more, eat better, we look at getting more local foods into the community food systems. We look at improving bikeability, walkability, and making sure people have safe transportation. The other 3 coalitions, Ashley's actually one of the leads, the woman manning the camera. Ashley leads AOD Prevention and Partnership, Alcohol and Other Drugs. Brighter Futures looks at oral health, young children to preteen ages, and then our Mental Health Matters. So there's 4 coalitions, there's 4 of us that lead these groups. So Recreate Health has 4 different goals. We look at, we have food systems here, so we do a lot with farm to school, farm to hospital, and community food center, if you've been hearing about that work. We also do a lot with food promotion and retail, so we're very involved in the farmers markets that are happening in Wood County, as well as promotions in grocery stores, smart meals, and restaurants. Community clinical linkages, we've been working with local hospitals to do non-pharmaceutical prescriptions, and most recently they're going to be doing non-pharmaceutical prescriptions to farmers markets, so people can actually get $20 vouchers for the markets. And then last but not least, which I'm going to talk to you about more, is, and this is where River Rider Bike Share falls under, is looking at infrastructure improvements and looking at community design, and is it designed for people to be able to bike and walk and have non-vehicular transportation for those who don't have vehicles, as well as making sure that it's safe and that people can find their way and there's signage and route systems identified. So that's kind of where Bike Share falls under and how it kind of makes more sense from a health system kind of perspective. So a little bit about the program. You might be surprised that it actually came to fruition in 2012. In 2012, a community resident came to the coalition, and Clean Green Action Team started kind of building this project together. And the residents saw a need to be able to have bikes available to visitors coming to our community so that they could kind of travel around and check things out. And see our community from a different way. So that's how this kind of came into fruition. So Clean Green Action, if you aren't familiar, they do a lot with environmental friendly practices. It's a very robust group that does quite a bit. And so they partnered with us for the health perspective. And in 2013, we started doing community surveys and assessments to see if residents saw that this would be a fit as well. And all the input came back that people wanted to see bikes available for people to use and for people to get around. And then we also started assessing where would we put bikes and what locations would make the most sense. And so we really looked at mile radiuses and different locations and how close and far away, as well as availability to have a front desk staff person be able to check in and out bikes. In 2014, we did our first bike rodeo. So they did a huge opening of bikes that community residents could donate. So the first iteration of our Bike Share program was a grassroots program, as I always kind of refer to it. They were all community donated bikes that were then taken apart, painted, and then labeled with a name. So some of them would be like Mickey, Ace, we had Mother Goose, and whoever donated the bike could actually name it. So there were some really fun names. And so after all of this initial planning and a lot of groups helping to get to this point, in 2015 was our first year that we launched River Rider Bike Share, our grassroots program, and we were at 4 different locations. We had the library, Southwood County YMCA on Pepper, Aspirus when the health department was on Aspirus, and then as well as Hotel Mead. So we had the first 4 locations in our first year, and our first year was one that was most successful. And I'll kind of highlight why we've got into this program here and the challenges as well as the positives that we've hit. So there's 3 locations. Our first bike share program was 24-hour rental. So it wasn't exactly a traditional bike share. Traditional bike share is really for short point-to-point trips. Our bike share was making bikes available to the community for a 24-hour time period. It was free, so there were some issues with that, with accountability and bikes being returned on time. And all it was a registration form that you had to fill out and a liability that went through the county approval process, and then a Google Sheets document that was shared between all 4 locations. So the front desk staff would enter the person's name, the bike that they took, the time they checked it out, and then they check it back in. And that had its issues as well. So a little bit about the past program. So like I said, there was a little bit of challenges. So with having that tracking sheet, not everyone is really familiar with Google Sheets, so a lot of times the information wasn't filled out completely. So it'd be really hard to see if somebody brought the bike back, if they went over the 24-hour time period. I found myself just having to drive to the locations a lot to see where the bikes were at and see what condition they were in, making sure that they were rebalanced. Thankfully I have a larger car, so I can fit 3 bikes back there if you squish them in. And I also had to track down bikes quite a bit for accountability. Since it's free and we didn't ask for anything to be put down, that was an issue. Over the course of 3 years, we had started with about 35 bikes and we had lost 7 over the course of 3 years to accountability issues. So that's something that we really wanted to look into, and there wasn't a good answer, and all the equipment that you put on a bike would be more expensive than a bike in order to track it. The other thing that came up quite a bit is our old bikes had a physical lock and key, a master lock and a key. So those, as you can imagine, over the weather, really started to get corroded and they kind of got a little hard to unlock. And then over the years, maintenance was our biggest thing, which really impacted quality and the number of bikes that we could have available, as well as accountability issues. So you'll see in the data coming up that as the years went on, our numbers of bikes decreased, and you'll also see our number of riders and bike checkouts decrease. So that's equated to quite a bit of different factors, but we still see it as a success. And then also capacity. So following on the coalition, this was actually a really good challenge, a positive challenge, if you say. We actually had so many people riding that it was hard to keep up as a small core coalition team with all the riders. So that was another decision factor in that we needed a more robust program that could help us do the tracking and help us do the maintenance and all those factors, because we just couldn't keep up with it anymore. So positives, as I kind of have highlighted on, is when we first did this program, we were really looking at recreation. And what we found through the data that I'll share with you is people are really looking at it for transportation as well as recreation, a little bit more than what we had anticipated. So that was a really positive find. We also look at it from a health perspective, a healthy way of getting around. It's environmental friendly with clean green action. People are really excited about it. We get a lot of positive feedback from folks. And on about a monthly basis, I get phone calls from out of state, people wondering how do we do our bike share program. They want to replicate in their communities. So little old Wisconsin Rapids is kind of getting put on the map when we come to rural bike share programs. So here's the data that I keep telling you about. So in 2015, we had 274 bike rides taken, and then 2016-17, you can see it decreases a little bit. And again, that attributes a lot that we were losing bikes. The bikes weren't as great as quality, so if we weren't losing them, we were pulling them because we couldn't maintain them. We were having a really hard time finding folks who know how to work on bikes and were able to volunteer their time to fix those bikes without paying them. This is here, I can't do anything, but also the capacity was an issue too. So we really didn't get to do a heck of a lot of promotion for things. I can probably hit this away. Here. Okay, we didn't get to do a lot of promotion. And then also, some summers it just rained a whole lot. So when we finally got the bikes out, it was just raining. And so the time that people would be riding the bikes has really decreased. So that's kind of what we hit those numbers with. Some positives or some unexpected finds, again, were that people were using the bikes mainly Monday through Thursday. And we had originally thought that weekends would be the highest use, and that wasn't the case. The most popular host site was first Hotel Mead in 2015, and then Quality Foods kind of took over. And I think that's where the bikes were kind of distributed to as well. And people who were using the program, they were like the good bikes and the kind of like, I'm not sure bikes. So that was another indicator to us that we really need to get better bikes and more bikes, that people aren't picking and choosing and having their favorites. They should all be the same. You should all feel like safe and that it can get you from point A to point B on either bike. And the average number of trips per rider in our first 2 years is about 5. So that was pretty good. People were coming back. A little bit more data in 2015-16, just haven't had 17 crunched yet. But again, the weekend rides is much lower than the weekday use. And you can see that people use bike share pretty much all hours of the day, but from 1 to about 6 p.m. actually gets probably the most use. So a little bit about community engagement. So one thing that we knew that we were having the challenges, and we wanted to ask the community, what are you seeing? What do you think? We can't really do a program for the community without asking them what they want. So we hosted multiple bike mapping workshops. We went to local events at the farmers market, lunch by the river, cinema under the stars. Just walked around and surveyed folks. We did an online survey to general public as well as post and current riders that we have from our listservs, and asked what do they want to see, and then asked some targeted questions for a more robust program that we were starting to look into. And so we really honed in a lot on membership options and making sure there was access for everyone. And so this is some of like the bigger feedback that we got is, of course, number of bikes and quality bikes, types of bikes, can they have baskets, can they have bigger seats? Again, the nicer ones, and I only rent the one that I feel safe on, and then that folks are using it to run errands or go get groceries. So that was a really neat conversation to have as well. So something that I want to deep dive just a little bit, and I'll pull you guys back out of the weeds because I might lose you a little bit, but it's important to me that I tell you why the health department's so interested in River Rider Bike Share from an equity lens, and I'll speak to equity a little bit more. And I have my notes here, or else I don't do it justice. So River Rider Bike Share, one of the biggest priorities for us is that it remains equitable and so that everyone can use it. And it's not targeted for low-income population, it's targeted for everybody. Everybody can use River Rider Bike Share. So when we looked at accessibility, we termed accessibility in types of bikes that would be available. So this is a cruiser style bike. There's other style bikes that are available. Membership options, how much will they be? Can people afford them? Locations, are they accessible to folks who are going to be using the program? In large cities, they kind of got hounded because they're putting bikes in places that more wealthy people could access them, and then it kind of targeted away from folks who could use them for transportation. And then also really just empowering people to have voice for additional change. So making sure that we are listening. Do they want bike trails? Do they want bike signage? Is there wayfinding signage? Do they want better roads? Are the trails mapped? Do they even know where the trails are and that they're available? So it was really important to us. This was a map, it's a little blurry on here, from one of our bike mapping workshops. So folks that were at the table could actually sticker places that they like to bike, places that they're proud of in their community, places that are some safety risks, that they've had bad interactions with vehicles or crossing roads or cracked cement. So making sure that people are able to kind of bring their thoughts forward is a very engaging way for the community. So when we think about equity, is anybody in this room familiar with equity or have heard about health equity? Okay, this is good. So hopefully I won't ruin your first experience. So health equity is really about how healthy you are is determined by a lot of factors, and these are the factors. So how healthy you are isn't just indicated by how many times you go and see your doctor and how you're feeling. A lot of your health is shaped by things that you might not realize. And this is where public health just kind of lives. This is what we do. So food, do you have access to healthy options? Do you have a good education? Do you have a livable wage? Do you have transportation? Do you have a safe place to walk and bike? Social. Are you able to socialize with folks? Are you shut in? Do you have access to a healthcare provider? All of these things are factors for your health, and all of these things is what we refer to in the health world as social determinants of health. So here you can see bike share really lives in this category here with physical environment, with transportation, and then we always lump walkability and bikeability together. They really kind of coexist. In addition to bike share, another area that it really hits on is in community engagement, making sure that people feel like they're the owner of this program. The health department doesn't own this program, the community does, and that they're asked questions, that they're part of it. And then also the bike share program itself makes a way for people to have social context and hang out with a friend or a relative or meet somebody new biking. So that's kind of where the social determinants of the health lie. So these are the factors that impact your health, and that how we make sure people have these good factors is how we create health equity. So health equity is different than equality. The verbiage changes, and it's a big learning curve for a lot of industries this year, is that equality really isn't the term that we're using anymore. Now we're looking at equity. My favorite description that my supervisor uses all the time is a pair of shoes. If you have a size 10 pair of shoes and you gave it to everybody in this room, it won't work for all of us, right? I'm an 8.5, it won't work for me. That would be equality. Equity would be asking you what pair of shoes do you need and getting you the right size to meet your needs, because your needs aren't the same as everyone else's. So I found this graphic was very fitting, especially for this topic of biking. Of equality here is on the top, so if you gave everyone the same bike, it's not going to work for everybody. Versus equity, if you give the people the bikes that they could use that fits their needs the most. So really how we impact these factors impacts health and impacts your health outcomes. So here's my diving deep into the data, and I'll bring you out of the weeds in about 2 minutes. Just entertain me here. You'll really love this. So here's some data just specific to Wood County that you might find interesting. So in the beginning, remember I referenced that we partner with the local hospitals to do a community health assessment and an improvement plan. So there's actually this like 100-page document all about Wood County that's all about health. It's a really entertaining read, great tabletop document. If you guys would like one, I can get you one. And it has really great information that can be used across all industries and sectors. So when we learned about physical activity, is that it increases with income in Wood County. So those with a higher income have more access to physical activity and are better apt to have more physical activity in their life. Now health, as we know, it's much more than just the visits to your clinical doctors. Health really is your basis of life expectancy. So our data and studies around the world support that people with higher incomes are living longer than people with lower incomes. So this is really looking at the social determinants of health, and are people able to access health in a way that's fair. Another pinpoint that we can talk about is obesity in Wood County. Higher income quartiles have less obesity than lower income quartiles. And they're also getting more physical activity. So again, we can equate this, that higher income quartiles in Wood County are living longer than lower income quartiles. This is our first data that we've ever been able to kind of put together that are starting to focus on social determinants of health. I have other data that I can show you about access to parks and things like that, but it's not equating it into race, gender, age. And so we're starting to really compile that data to see where are we missing the gaps. So, coupled with the community input from all the bike mapping workshops, the surveys, the questionnaires, and what we know as public health professionals, we decided that it would be smart to move forward with a more robust bike share program, and that it's what the community wanted, and that it would be good to start addressing some of these issues that we're seeing in the community from health lens. So in 2017, we presented and procured funding from Legacy Foundation here in town, and they are funding 6 locations, 5 bikes at each location for a total of 30 bikes for 2 consecutive years. And then additionally, we also have additional grant funding from a Catalyst grant from University of Wisconsin through Wisconsin Prevention Partnership that will allow us to purchase additional bikes that are accessible bikes, do some more community engagement pieces, and then look at trail signage and wayfinding and route mapping as well as bike lane painting potentially as well. So a lot of energy around this. Wisconsin Rapids is the first rural community to implement a bike share, so you can be very proud of something that's happening right here. So a little bit more about Zagster, and then we can get into some more fun details about the bike itself. They kind of cured all of our challenges that we're having. They do all the tracking. You can see down here, I can pull up reports on a daily basis about number of people riding and where they're taking the bikes and how many members that we have available, how long they're taking the bikes for, how often they're doing the trips. They do the rebalancing. There's a local mechanic that's actually hired through Zagster. He lives in Nakusa. And he put all our bikes together. He put all our bike racks out. He goes through on a once a week basis and make sure they're all lined up, the tires are pumped, that they're in working condition. When people are done riding a bike, they have the question, is anything wrong with it? They can enter the information, and then so if it's outside of his 1 week cycle, he can make a special trip to make sure that bike's back in working condition. So the maintenance piece is huge for us. The data piece is a big plus. And then it takes the work off of those businesses that were supporting us before, their frontline staff. Bike share really wasn't their main job priority. They had many other things going on, so it was nice to kind of take that back away off those locations, but still having the locations there. They've been really excited about the new program. So a little of what's different about Zagster versus some other bike shares that you might have heard of in Madison. If you've seen those bikes, those are through B-Cycle bikes. Those are kiosk based. So you actually walk up and there's a kiosk, kind of like a ATM. You put your information in and then you can rent it. We do not have a kiosk, but we do have a loading platform is the locations that you'll see. So Zagster is a flexible. What flexible means is that we have a specific location that the bike needs to be returned to and picked up from. But say if I'm on my bike and I wanted to make a trip here, but I'm going back to the health department, I could lock my bike here, put my trip on hold, then restart my trip and go back to the health department. So I can make midpoint stops. That's what the flexible program is about. And then Dockless, this is the one that you probably hear the worst reviews about. This is the one that people say, bike share, people leave bikes everywhere. Well, that's what Dockless is. They don't have a start or end point. You can take a bike and then you can just leave it somewhere. So you can imagine in bigger cities that might be okay, but in rural communities you might find bikes in places that probably wouldn't be very useful or handy. We probably find bikes everywhere. So it's nice that we kind of found that middle solution. We have a start and end point. You can do midpoint trips, but we know that you can find bikes at a specific place when you're looking for them. So a little bit about the bike, and I have one here, so you guys can kind of play around with it at the end if you're interested or kind of look at it. It has a really nice bell. We always have some fun when we go on our lunchtime little strolls over the health department. We like to make sure everyone knows we're coming. It has a great basket in the front, which I'll talk a little bit more about. When you pedal, there's a light up front that turns on, so even the day it's on, but at night it'd be very nice for safety reasons. It's pretty darn lightweight. It's a very low cross step bar, so people with hip issues or mobility issues, it's not a whole heck of a lot to get your foot across. And then we can talk about a little bit about how it works more. There's a keypad system in the back and a ring lock that locks the bike up. So there's also, I should mention, gears. You can shift gears too, which is very nice. And they're very high quality bikes, better than what I had even expected myself. Our local technician works on bikes across the nation, and when he was putting these together, he was pretty astounded by the quality of the bikes as well. He said, you know, I thought I was going to have to work on these quite a bit, but they're quite nice. I think I'm not going to have to do a heck of a lot every week. So, and he really hasn't. There haven't really been any issues so far. So that's been a really nice thing for us in our investment. So again, we engage the community. Where do you want these bikes to go? Here you can see a map. There are 13 different locations that were first identified through all those workshops, the surveys, the online questionnaires, about where people suggested, and then we took the top 6. And so this is where we landed on. So they are at McMillan Memorial Library, Quality Foods West Grand, Quality Foods Baker. They're at the zoo, which was a really neat one that we never would have thought about, but it came up through a lot of our community engagement. 8th Street on Pizza Hut at Pizza Hut, and then Veterans Memorial Park, which is where I grabbed this bike from this morning. It was like maybe a minute ride over here waiting for traffic. So very close to all of the county employees that we can kind of access these. So the membership options. So once you find a bike, there are 4 different options for memberships. And you can either sign up online on your desktop computer or on your phone or through the app. So there is pay as you go. This one is toggled right now, an annual membership. So pay as you go, you pay $1 for every hour. There's no upfront cost. This is more like people just kind of trying it out, see if they like it, see if they would rather want to invest on a monthly or an annual membership. And you can only get charged up to $16 a ride for the day, and that goes across all memberships. Annual membership, it's $20 for the year. Your first hour is always free, and then any hour after that is $1. So today, my first hour is free, and I'll probably be here over an hour, so then I'll get charged $1 on my membership. But at least I always get that free. And I've ridden the bikes about 20 times, and I've gotten my money back already on my membership, all under an hour. Student membership is the same. It's $15, and it's an annual membership. Trips under an hour are free, $1 after that. You have to have an mstc.edu login to access that membership. And then our last one is monthly, and that's $5 a month. Again, first hour free, $1 after that. So all of them get capped at $16 for a ride. If you keep the bike longer than 24 hours, you get charged $30 for an overnight fee. What we really don't want people keeping the bikes for that long. It's not what the bike share program's made for. Bike share is intended to be short point-to-point trips. And if everyone keeps the bikes overnight or for long periods of time, we won't have any bikes at the locations for folks to use. So that's really trying to negate the overtime for people. Here's just a really cool graphic that we get from Zagster. They send us really neat promotional items. This is kind of showing you what it looks like on the app when you log in, and it shows you the time and duration. I can go through it a little bit slower than this. So what happens when you get, if this is your Zagster app on your phone, so when you walk down to a location, so when I was down by Veterans Memorial Park, it would say Veterans Memorial Park right here, and it said 5 bikes are available. So I clicked on that, and you click unlock. This is when you're signing up. It will ask you if you want to do membership options. You pick which membership option you want. It will ask you for your information. Once you pick what location you're at, there's numbers on the front of the bike. And so the numbers of all the bikes that are available will pop up. And so you click, I want to ride 1410. So you click 1410. And once you click that, there's this ring lock that's right here on this back of this bike. You might not be able to see it, but it actually pops up and unlocks. And it's all done through Bluetooth connectivity through your phone. So that unlocks and you're ready to go. You can take the bike. It's pretty seamless and pretty quick. I walked up to the bike and I was on it within 10 seconds. So here's a little video that I'll show you that kind of highlights a little bit more, since we're not at the actual station, how to use it. So just to give you a little better idea of how it works, I gotta go back and present. So very seamless. So right now, if you don't have a smartphone, you can use SMS text through your not smartphone. There's a number at the wayfinding signage next to the bikes that you text, and then you can just text what number of bike you want, and it will send you an unlock code. So that's what these kiosk numbers are back here for. So if you don't have a smartphone where you can connect and unconnect with Bluetooth, you would just type in the number back here and do it that way. Also, if you have a smartphone and you're having issues connecting with Bluetooth, you can do SMS text as well, and they'll send you a number. All you have to do is make sure that you sign up for your membership online prior to going, so that your information is already loaded and downloaded. So again, just to touch on a few last things, we're almost done. So equitable approach. Again, I mentioned that Catalyst grant. And so when I was talking about the different accessible bikes, we went to a bunch of different organizations and asked folks what kind of bikes they would like to see in addition to the cruiser style. So there's actually 3 more bikes coming. And what we thought was surprising, we thought everyone would really like tricycles. But in fact, we're going to be getting 2 side-by-side tandem bikes. People are really excited about being able to take a friend or a family member and go biking, or maybe somebody who has really mobility issues, so somebody else can bike with them and they can enjoy the bike ride. And then we also have the recumbent, or the standard tricycle coming, which has a big basket in the back and has our larger seat that's durable. People were asking that they wanted a bigger basket, so if they went grocery shopping or did some quick errands, that they could pick that up there. So we will have a standard tricycle and 2 side-by-side tandem bikes, hopefully coming end of July, early August. We order those at the same time as these, but they take a little bit longer to be manufactured, come in, and they'll take a little bit more time to put together. But those will be available hopefully soon, and they'll be going through the same checkout process. In addition to the Catalyst grant, again, that was the $50,000 from the Wisconsin Partnership Program. In addition to the bikes, we're going to be working with the city to implement some bike lane and wayfinding and route signage. We're working with some trail signage currently right now, and then doing a lot more community engagement. So Bike Share rolled out a month and 3 days ago. So we're going to be starting to hit up some local events and working with local organizations to teach people how to use the bikes, especially the different employees in areas that are close to the bike locations, so that people feel more comfortable using the bikes. Community impacts. This is that data I was telling you about that's not equity related, but we know that 1 in 4 residents live without park and recreation nearby. We also know that 1 in 5 reports no physical activity in the past 30 days when sampled. So we know that our community impact, these are some of the things that we're trying to address here, as well as the social determinants. We are trying to increase social cohesion, the transportation, public transit accessibility, that's always been an issue in our community, physical activity and recreation, and then really just overall impact on chronic disease in our community. So our evaluation and success, I think I've got 3 slides left here. So number of riders. So if you saw in the 2015, I think we had 264 bike checkouts and 64 riders. I just checked this morning. That was for a whole year. In just 1 month, we have 81 riders, and we've had over 100 bike rides taken. So we're well on our way to hopefully meeting our goal of 400 members for this first Bike Share season. And we haven't done a whole heck of a lot of promotion yet, because we just kind of wanted to see how people would react to finding them, or how they're seeing it through our Facebook pages. So we'll be looking at number of rides, duration, number of bikes checked out, number of trips per rider, to see if once we hook people in, are they coming back for more. And then again, like I touched on, really looking at signage, infrastructure improvements. I think with additional bikes in the community, we'll see more people riding on the bike trails. Expansion of our Bike Share program throughout the county. So we don't want to just keep this to Wisconsin Rapids. We hope to maybe in the future years get one out Port Edwards, Nakusa, Marshfield, Auburndale, Pittsville, so people can start actually connecting from community to community. And then having those cross-sector conversations for more of that regional approach to Bike Share. So we're actually going to start trying to pull multi-municipality conversations together about bike and pedestrian planning, and what that could mean for our county in looking at non-vehicular ways of transportation. So the last thing I want to touch on, I'm pretty sure this is my second to last slide, sustainability. So the cost of Bike Share is never made up for with membership fees. and that is across the nation. It's not meant to be a profitable entrepreneurial business. It doesn't work like that. It's really seen as a community asset. And it's been really nice to show the data and show the community engagement and be able to have funding that supports having a community asset in place that's not necessarily always going to make us money. So kind of thinking about health in a different way and really making the investment in the health of your community versus looking at the dollar. So Bike Share is funded for years 1 and 2. And I said I would talk about the baskets some more. So you can see on the sides, they're very strategically empty. So on the sides of these baskets in years 3 and 4, how other Bike Share programs are funded is they look at community donations and community business sponsorships. This fall we'll start working with local organizations to have funding for years 3 and 4. And with their funding, they would get their sponsorships on the side of the baskets, on the wayfinding signage that we put up. So it's kind of another way for them to get their name out there as well. So where can you find us? Zagster.com. There's an S in there. There shouldn't be an S. It should be Zagster.com/River Riders. That's where I just showed you the video. You can sign up there. There's more information on how to use it. We have our Facebook page, River Riders Bike Share. If you're interested in Healthy People Wood County, we have our own Facebook page as well. Healthy People, if you're interested in the mental health, AOD, Brighter Futures, that's where we post a lot of our information. And then also you can download the app Zagster, and it's for Android or iOS. Any questions for me? Any thoughts?
So the one that you're planning on having coming, that's the tandem side by side?
Yep.
So is that going to have any sort of like seat belt on it or anything like that?
Not that we are able to implement now. So we were hoping that we might be able to add features to it. So we did a bike workshop at ODC, especially thinking about folks with disabilities. And that was one of the feedback is if we could have some type of sidebar or seatbelt added. So once we get the bikes, there's definitely potential that we can see if one of the local manufacturers could add something to it.
I've seen this movement, and you can see it on YouTube. It's about finding people in the community who would be willing to go to nursing homes and pick up people who just haven't been able to get out into the and then to feel the wind and engage in conversation. And you got that new trail that goes up by Strawberry Lane now.
Right through Beer in there. Yep.
But I could also see that as being an issue with somebody slipping off and falling.
With the mobility issues. I think that's great, and we've learned a lot through our Bike Share partnerships with other communities and different conferences that we go to, that being on a bike is much different in experiencing your community versus being in a car. And so for elderly populations, or even just for myself, I've driven through the downtown countless times. When you bike through it, you see it in a very different way. You see everything, and you didn't just pass it by in a blink of an eye. But it's a different experience, and it's really good health-wise to get out. So that definitely could be something that we look at. There's a program in Stevens Point right now that's actually doing ageless cycling. What is it called? Do you? Oh, okay. It's called, well, they have a catchier name than ageless cycling. Hopefully he's never going to watch this, but that's something that we could potentially replicate here too. It's a really good thought. Thanks. Do you have a question?
I was just wondering, because the last bikes you said there were bikes that were lost or stolen or misplaced, whatever, didn't come back home. Do these have GPS locators on them so that won't happen?
These do. So right now we can't see exactly where you take the bikes, but if they don't come back, the GPS, we can ping the last known location, and then that's where we can go find them. Yeah. So we don't, I don't ever want people to think like we're watching you where you take the bikes. We won't ever know who has the bike or where it is, but we can figure out if it doesn't come back where it is. So, yes.
When you're talking about the membership, is it pay as you go? Like if I just want to go down to the zoo, I live near there, and just pick one up to take it for a ride.
Yep.
Do I pay for that, or as long as the first hour is off, I have to have a membership? Is that what it is?
Pay as you go is the only one that the first hour isn't free.
Oh, okay.
The monthly, annual, and student are where you pay up front. So you pay that $5, $15, or $20, and then your first hour is free. An hour after that's $1. Okay. Pay as you go, you don't pay anything up front, but you pay for every hour you use it. So if you did want to go to the zoo and just try it out, and you had it for an hour, you would get charged $1.
Okay.
Yes.
How does it charge you though? I mean, I guess what is it?
So when you Yep, so when you have to put your credit card information in. So you have to have something on file in order for you to rent a bike out. Yep. So if you sign up online, then you can do the SMS text message, or if you have your iPhone, you can put it into the app.
Okay,
Yep.
okay.
So is the light that is operated going off the hub of the front wheel, or?
It is, yep. There's actually wires that connect into the back because there's a red reflector light on the back that turns on too. So when you pedal, it creates that motion and it lights
Not
the...
like way back in the 70s, they used to have those lights that sat on the rim, and then that always like slowed you down, so.
Oh, yeah.
It's not on that.
No, it doesn't slow you down, but it's all generated from the pedaling. It's pretty cool.
And then that table lock, like, so then when you stop, so if I wanted to stop paying for the first hour, I could just go back on the app and then stop it,
Yep.
and then click back on. But then just the one where I want to tie it up to a metal sign or something?
Yes.
Is that on the bike there then?
Yep. So hopefully, I don't know if everyone will be able to see. So here, this is the U-lock, and you only use that when you're at the bike share station, and you push the orange tab down that's back here, and it locks the lock underneath. That's when you unlock it or lock it. Say you made a midpoint stop. Let me pull it this way. Here's that U-lock, the orange tab, so it's unlocked right now. If I push it down, it will lock. If you make a midpoint stop, that's what this is here. So you make a midpoint stop, you find a bike rack to tie it to. This comes here, and you put it into there, and it locks your bike. And then you push on your bike that you're taking a midpoint stop. Here, here's my phone. I can probably do this right now for you. So, let's see. Right now it says, oops, trying to connect to Wi-Fi. We all know that doesn't work very well around here. Okay, so turn my Wi-Fi off. So lock, prepare to lock bike. So I'm just gonna hit, I'm not ending my rental, me holding. Preparing to lock bike. So I'm gonna put this in here like I'm attached to a light pole and push that down. Done. Okay, so now it registered that I locked my bike. So now I'm going to unlock my bike. See? So the orange pops up and that unlocks the U-lock, and when that does that, it unlocks this cable as well, and I put it back. Yeah, so now I can take my bike back and I'll Veterans Memorial Park. I would hit prepare to lock bike, and then instead of hold bike, I would say end trip. And so when you pull this up to that bike rack, there's a cable that's right next to the station. You put that cable cord in here, and then you push down this latch, and you're done. And the best way to make sure you end your trip, because if it doesn't end your trip, you'll still get timed. So you end your trip, it will say on your phone, your trip has ended. So that way, that's like your fail-proof way of knowing that you locked it up correct. And then it will say, you had your bike for 1 hour, 3 minutes, and 56 seconds, and you were charged $1 today. So it will tell you everything on your phone. Yeah.
What'd you do with all the old bikes?
So all the old bikes, some were taken to Choose to Reuse last year. We actually probably took about 50 bikes over there. So when we did our bike rodeo roundup, we got a lot of bikes that weren't in usable condition. So those bikes we took to Choose Reuse. We have about 10 bikes left that are more adolescent bikes, and those are sitting in storage right now. They're in a little rough of condition. We're actually talking with the Boys and Girls Club to see if there's a way to kind of make like an entrepreneurship for the kids to kind of start a bike fix-up program. So maybe it would be open like Tuesday mornings from 8 to 10, and anybody from the community could come get a bike tune-up. And it would be a way for the kids to kind of like create their own business model, essentially. So we're starting to have conversations like that. Yeah. Any other questions? Any good?
What's going to happen to the bikes in the winter then? I mean, obviously, you take the whole rack and everything out, or does the rack stay and then you're going to...
Yeah, so there's 6 locations right now, and what we'd like to do is leave 2 of them out over the winter to see if we have any interest in winter riding. So the bikes can stay out, or Zagster, with the contract that we have, they'll come take the bikes and they'll store them or find storage in the community that they can put them. So we're hoping to leave out 2 of the 6 locations, and with that Catalyst grant money, we're hoping to actually put coverings over the 2 that will be out. These bikes are meant to withstand all types of weather, but not necessarily buried in snow. So as long as we can get the racks implemented, then we'll leave them out. So that's kind of our decision factor, and that's what we're working on right now.
Are we able to up and down the seat at all, like move?
Yeah.
Okay.
Yep.
good.
I actually
Yeah,
did
looks
that
like
one.
it does,
Yep.
So that's why I was just wondering.
Yep, you just have to pull this part out and then you can adjust it. And it's, everything's very theft-proof on here. There's bolts that don't have bolt ends, like you have to have a special tool, so you can't take the, and they're very durable and very comfy. So you can adjust it and it's very easy. I had to adjust it when I first picked it up myself, so I'm a little shorter than whoever rode this before me. But,
Is there any like weight limit for that?
Nope.
That you know of?
not that I know of, nope. Mm-mm. Any other questions? No?
I lost my bike this last week when we went camping and they fell off the back end of our bike rack broke.
Oh
We
no!
had 4 adult bikes, my daughter and her husband and my husband, and we ride all the time, and it's like, I don't know what I said, oh my God, you know, and they're not covered by insurance, I tried to check on insurance.
Right.
They said, no, even though it's connected to your truck, it's not.
Oh gosh,
We're
yeah.
going to a bike trail and just, we're on a back road, a country road, and, I mean, it was a regular highway, but it had a bunch, in the bike rack, it sheared the pin, and it hit, and
Oh,
I don't think
yeah.
we'll be able to recycle any of them, but I'm like, I want to buy, we love to ride.
Yeah.
Like, this is perfect.
You can definitely try out one of these.
Try and
Yeah.
so we get new bikes or figure out what we're gonna do.
Right, yeah, no, absolutely.
I know, it's the one thing we like to do, especially like on a night like tonight when it's so nice out.
Yeah. So hopefully this is like my first presentation. I've been up at Farm Tech Days for the past couple weeks, but we're hoping to go around for quite a bit. So if you know anybody who's interested, have them connect with us. I'd be happy to come present at different organizations or come back to the county and like specific departments and teach folks. Hopefully soon we'll be getting some promo codes that I can hand out. So once you sign up for a membership, you can get a first hours, a few more free, kind of get people signing up and testing them out a bit. So hopefully we'll have a little bit more promotion coming up. But please help spread the word too. Cool. All right, awesome. Thanks, guys.